Hi, you're watching DNA Today, a multi-award-winning genetics podcast where we explore everything to do with genetics, from CRISPR to rare diseases to new research. We have won the Science and Medicine Podcast Award for many years now. We have hundreds of episodes, and we really hope you enjoy these conversations where we dive into so many genetic concepts. I'm Kira Deneen, a certified genetic counselor and your host.
Hi everyone, my name is Avital Habshush and I am a current graduate student at Sarah Lawrence College. I have the pleasure of being with an award-winning genetic counselor, Monisha, here. We work together to design this cardio session, and this is part of my rotation here at DNA Today with Kira. So Kira, thank you so much. Monisha, thank you, and enjoy.
Hi everyone, this is Monisha Sebastin. I'm also a genetic counselor and I graduated from the Sarah Lawrence program in 2018. It's a pleasure to be on DNA Today. Thank you, Kira, for having me, and thank you, Avital. It was great working with you and planning out this session, and I hope all of you enjoy it as much as we enjoyed working on this. Hi, Ms. Loveheart. My name is Monisha Sebastin.
Hi, Monisha. Nice to meet you.
Nice to meet you as well. I'm a senior genetic counselor at DNA Today, and thank you for making time to meet with us today.
Thank you for making time to meet with me, to talk to me about my family.
How would you like me to address you? By your first name, last name, and what are your pronouns?
Sure, you can address me by my first name. My first name is Lev.
Lev. Okay.
And my pronouns are she, her.
Okay, Lev. Thank you. Anytime I meet with a patient, I always like to know what is your understanding of why you're meeting with genetics and what your hope or expectations are from this visit.
Yeah, so I was told by my doctor, my cardiologist, to come here today just because I fainted once when I was doing a HIT class, and then I told him a little bit about my family history. So he thought it was a good idea to come and talk to you.
Okay, I did take a look at your chart. Thank you for giving me the summary of your understanding, and that's exactly what I gathered from your chart. It was because of your personal history and the family history that the doctor wanted to make sure that there are no underlying genetic causes that we might be missing on. What we are going to do today is I will be asking you a lot of questions, and the purpose of these questions is to help me understand what is going on in your medical history and your family. Some of these questions might be related to some sad memories or family members. Please know, if you feel uncomfortable, just let me know. These questions are not meant to make you uncomfortable. It's only to help me understand what's going on. Okay? And throughout the process, please feel free to ask me any questions or any clarifications you need. And once I've gathered the information, which would be your medical history, your family history, and then we will talk about the genetic testing options that you have. And just because you're meeting with me today does not mean you have to do the testing. I know that's why your doctor sent you here, but I want you to know you are in full control of this session. After listening to the pros and cons of the testing, you can decide whether you want to do it today, or you can tell me that you want to go home, talk to your family, or get a second opinion, and then come back in like a few weeks or few months, or we can also decide that this is not for you. Irrespective of what you decide, the care will be the same.
Thank you. I appreciate that. I'm just coming in a little nervous just because this is talking about me and my health, and I thought I was really healthy, and I just, like, this was kind of surprising, and I appreciate you telling me also the opportunity of not necessarily doing the testing because, this is a little overwhelming.
I can only imagine, and from what I read in your chart, you did not see this happening. You've been a pretty healthy individual all through your life. And then suddenly this one episode happens and they're throwing these big names at you. Did you go home and read about it?
Yeah, I Googled and ChatGPT. Those are kind of my two friends. And then you get stuck in this spiral of things over and over again. And you just, I got a lot of information, and I just hoping here that we can make some sense of it.
And I hope I can help you with that. And you mentioned about being anxious and nervous for this visit. Are you comfortable with the plan of what I gave you? We'll start with the information and then I can talk to you more about the condition.
Yeah.
Or do you want me to reverse the...
No, I like the way that you laid it out.
Okay,
that sounds
perfect.
good to me.
So I reviewed your chart and I have some information that I gathered from the chart that I want to verify with you. And I also have some additional questions for you. From the medical history that was documented, there was report of you having some fainting episodes.
Yeah. Once when I was little, I was like in second grade, and then it was funny. My brother kind of like snuck up on me, and he just went boo, and I wasn't expecting it, and I kind of got like really overwhelmed, and then all of a sudden I noticed that I was on the floor, and my parents were like, "What happened?" And my brother got really nervous because he was playing a joke on me, and I play jokes on him. Yeah. But that was kind of like the first time I fainted, and then I fainted maybe like once more when I started like in a Zumba class, because I like to be active and try new things. So in high school, a friend of mine introduced me to Zumba, and it was going well, and then I think I was just getting like really hot halfway through. And then was this like other time just recently, a few weeks ago, where I wanted to again incorporate my like up my exercise game, and I tried to do this HIIT class because I learned that it's really good for your health because it's cardio, and then sometimes there's like weights with it too. But then also I was kind of doing that, and I fainted.
Okay, thank you for sharing about the 3 episodes. I have a few follow-up questions. So the first instance, it sounds like you were scared, your brother scared you and you fell. The incident with the Zumba class and the HIIT, would you say you were dehydrated? What were the circumstances on that day? Like, did you have your breakfast before, or did you have like a meal before the class?
Yeah, I mean, each day, I am pretty good about drinking my water, so I don't think I was dehydrated. I mean, it was high school, and now I'm in graduate school, so I'm like a little stressed out from there. So I was thinking maybe it was just kind of like stress times where I was doing this as kind of like a release of energy, and I might have just, I was stressed before and then try to use exercise to de-stress, and this just happened.
And you've been doing HIIT classes for how long, would you say?
So this was just my first time doing HIIT, but beforehand I was doing a little bit of yoga, and I was doing some water aerobics and like swimming. Those were kind of my big things. I started to do a little bit of running, but this was kind of something new that I wanted to try.
So you have been pretty active, and you've not had these episodes in the past except for the Zumba class once. Have you had any episodes of your heart beating funny, difficulty breathing, or walking or climbing up and down stairs that you were able to do before that you're not able to anymore?
Yeah, I mean, when I was a kid, sometimes I would just like lay in bed at night, and if I was nervous, I would feel it like beating a little funny, or even if I was just like sitting in class, there were moments where I noticed that it was like sounded a little funny or felt funny, and my doctor now, and even when I was a kid, mentioned that like my heart rate's just a little bit different than everyone else's. I don't remember if it was faster or slower or what that meant, but I remember it being slightly different.
I see. Okay. And you mentioned these episodes happen when you're anxious, nervous, or has that happened even when you're just sitting and reading a book and you're calm?
It's happened even when I was calm, so it wouldn't necessarily be when I was just anxious.
And we spoke about the instances of you having fainting, blackouts. Any episodes where you have had like near fainting situations or feeling exhausted more than what you would typically feel?
Trying to think near fainting, usually not with blood, but in school right now I'm learning about like some biology classes, and we had to watch a birth, and that kind of, I felt myself almost fainting, but I've heard stories like that before.
Yeah, okay. And besides the symptoms that I asked related to the heart, do you see any other specialist, any other doctors besides your primary care physician and your cardiologist? I couldn't find any in your chart, but I want to make sure that you're not seeing any providers outside of the system.
No, just, sometimes I see a dermatologist for acne, but otherwise that's pretty much it.
That's pretty much it. So this has been the first major life scare that you've had. Okay. And when you experienced the fainting episode after the HIIT class, what happened? Did they take you to the ER? What was the...
Yeah, all of a sudden, so I kept my keep in my wallet or on my phone. There's like different cubbies in the room, so my wallet and my phone were there, and they found my insurance card, and my phone has this like emergency contact set up to it. So it was set up to my best friend, and they called my best friend, and then they told them that they were going to call an EMT and sent me to the ER. And so I was at the ER, and then my friend was there when I kind of came to it.
And they did an evaluation there. Did they tell you anything about what happened in the ER? Because the ER visit was not in our system, so I don't have records from that. So I'm just trying to gather more information.
Yeah, they told me a little bit about my heart rate, it was kind of off, and something about like a T shape something, or something with a T. So I don't necessarily remember exactly what it was, but they had mentioned something about it.
Got it. Okay. And that was from the EKG or the ECG where they put those stickers on you?
Yeah.
Okay.
Yeah,
Okay.
I remember.
And that led you to Dr. Curzon.
Exactly.
Okay. And I'm going to ask more questions about your family. Now, thank you for all the information you shared about your health.
Thank you.
Is there anything else I should know about your health?
No, that's
Okay. Do you have any children?
No.
Is that by choice or medical reason?
By choice.
Okay. And do you have any siblings?
Yeah. So I have an older brother who is 2 years older than I am, so he's 32.
Okay.
He's good, and then and he's fine. He's in good health. And then I have a younger brother who actually recently passed away within a year, like about a year ago. He was running, and then he just stopped running, and everything just stopped, and he suddenly went into like some kind of, he just died.
I'm so sorry for your loss.
Yeah.
I see you getting emotional. It sounds like the two of you were very close.
Yeah.
You mind if I ask more questions about him and his health?
Yeah.
Okay. So you mentioned that he passed away a year ago. How old was he?
He was 25.
25. And prior to his passing, did he have any known diagnoses or medical concerns, health issues that you are aware of?
Nothing really. I think they might have said he had like a funny heartbeat kind of, and that T-shaped thing that I mentioned before. But otherwise, like no fainting and nothing else. Like he was healthy and fit, and he had just finished college, and he was like starting his second year of his job, and he was like always in shape and just, yeah.
He sounds like an active individual.
Yeah.
And you mentioned that they saw something with the T wave. When was that done? Do you recall how old he was or where that conversation came up from?
Yeah. He was like 15, and he wanted to join the basketball team in school. And the doctor recommended not to. And my family, we don't really talk a lot about health. It's like, I guess it's maybe like a little bit of a cultural thing. So they said he shouldn't join the basketball team, and they didn't really explain to me why. They said something about his heartbeat and the T wave, and they said, like, kind of just like you. And I was like, oh, well, I'm not good at basketball anyway, so I'm not going to play basketball. Like, I didn't play basketball, and like, okay, like, he doesn't play basketball. That's just something we don't do.
Okay. You mentioned about the family not sharing. That's something I hear a lot. It's common in some cultures. We'll work with what information we have, and it's okay if you do not know. I should have said this in the beginning. It's okay if you do not know any of the questions that I'm asking. We'll work with what we have. Okay. You mentioned about family mentioning to you that you have the same T wave, and that's why you did not pick up on, or you did not choose basketball. So you've had cardiac evaluations in the past before this incident?
Nothing too extensive. I just remember, I'm trying to remember because I was a kid. So I think it was just kind of like the doctor. I remember seeing like my primary care doctor, and then one time, maybe this is like after second grade, when my brother scared me, and like this was my older brother, not my younger brother.
Got it. Okay.
And he just and I remember them saying something about my heart, and my heart's a little different. My mom was like, just because you just have a really big heart and you love to give to people. I know it's sweet, but you know, what is that?
What does that mean?
Yeah.
Right. Yeah. And going back to the conversation about the family and your brothers, you mentioned that your brother who passed away, it was all of a sudden. Was it in New York State, New York City, and was an autopsy done?
Yeah, it was done in New York City. And they did mention that there might be some kind of cardiac, like heart problem that he has. Something like between the breaks, between the heart, I think. Like there's just not enough, like something, they saw something looking funny with his heart, and they said it was a heart problem that all of a sudden.
Do you by any chance happen to have a copy of the report?
I don't have it with me, but I'm taking notes here anyway, so I can just try to get a copy of those two.
I can give you my email address, and it would be helpful for me to know what the finding was in your brother's report. And your brother who passed away, does he have any children?
No children.
And that's by choice. And your 32-year-old brother, you mentioned he does not have any health concerns, medical issues, any children for him?
No children.
Okay. And has he had any cardiac evaluations in the past?
No cardiac evaluations.
And has he experienced any of the symptoms that I asked you, like the shortness of breath, tiredness, palpitations?
Nope. He tends to, he is fit in his own way. I think he'll do some weightlifting, but not super into exercise. And he's someone who prefers to be indoors and reads books.
Okay. He's more weightlifting, not a lot of cardio.
Yeah.
Okay. Are these brothers your full brothers?
Yeah.
Okay. Any half siblings?
No half siblings.
Okay. And your parents, are they alive?
Yes, they are.
And how old are they? You can give me approximate age ranges.
Sure. My dad is 60 and my mom is 60 as well.
60 as well. Okay. What I'm doing here is just drawing a picture of what's happening in your family. This is more of a cheat sheet for me to easily visualize what's going on. The squares represent the biological males in the family, and the circles represent the biological females in the family. Okay? And let's start with your mom's side of the family. From the notes that your cardiologist had, it sounded like there wasn't a lot going on, but I'm still going to ask questions.
Sure.
Any aunts and uncles on mom's side?
Yeah, my mom has two sisters.
Two sisters, and they are full siblings to your mother?
Full siblings.
And how old are they?
They're 2 years younger. So 2 years and then 2 years. So 58.
And 56?
And 56, yeah.
Okay. Your mother, does she have any medical concerns?
Nope. A little bit of sleep apnea, but otherwise nothing else.
Besides that, and she gets annual checks. No concerns with her heart.
She's really good about that. Yeah.
None of the symptoms that you or your brother shared.
Nope.
Okay. And how about your aunt, who's 58 years old?
She also seems to be fine. Sometimes she struggles with her mental health a little bit, but otherwise nothing, no heart problems along those lines.
Nothing major.
Nothing
going
major.
on. Okay. And what about your 56-year-old aunt?
She's good. She's fine, healthy.
Okay.
Yeah.
And do you have any cousins on your mom's side?
I do.
Okay. Let's talk about the 58-year-old aunt.
Okay.
How many children does she have?
She has 3 sons.
Okay. Do they all share the same father?
Yes.
And any major health concerns, medical issues for them?
No, they're all healthy and fine.
And they're doing well in school. They are independent. They can take care of themselves. Nothing with the heart. No seizures.
Yeah, I mean, they're all fine. One of them is on the autism spectrum, but otherwise they seem pretty, they're great. And they're all working in their own capacities, and yeah.
The cousin with autism, any other delays, difficulties for him?
No.
And how old is that cousin?
He is 23.
23. And he is high functioning, it sounds
pretty
like.
high functioning. He needs some assistance, so he works now in a grocery store and helps out, which he loves doing, and he keeps telling me about all the new foods that keep coming into the store, so we like to talk about that.
And moving on to your 56-year-old aunt, how many children does she have?
No children.
And that's by choice or medical reason?
By choice.
And your grandparents on your mother's side?
Yeah, they're no longer, they're both deceased. They passed away in their 70s, and I think one of them might have had high blood pressure. That was my grandmother, but otherwise my grandfather just passed away, I think, of old age.
Okay. Now, your mother's side of the family, what would you say is the ethnicity or ancestry?
Sure. I think they're originally from Poland.
Okay. Any Jewish ancestry on
Yes.
mom's side?
Ashkenazi Jewish.
Okay, moving on to your father's side of the family. Any major health concerns, medical issues for your father?
Yeah, my dad had a heart attack actually when he was 55.
Okay, and only one episode of the heart attack?
Yeah.
And how is he doing now? What his medical?
Yeah, he's okay now. He has really changed his diet and is eating a lot more healthfully, and is also slowly doing some exercise, but nothing too intense. And he seems to be doing well.
Okay. Did his cardiologist talk about any interventions for him at all?
I don't remember. He also doesn't really talk
Share
about
much.
those
Okay.
things. Yeah.
That's okay. Let's talk about your aunts and uncles on dad's side of the family.
Yeah.
Do you have any aunts and uncles?
So he has One sister.
One sister, same mom and dad?
Same mom and dad. And she is currently 55.
Any major health concerns, medical issues for the aunt?
Well, we talked a little bit about fainting, so she faints a lot.
Okay.
But in my family, the way we talk about this is they just say that she's like a very emotional person.
Okay.
So she feels her emotions like really strongly. And like the fainting is maybe just her expressing her emotions in certain ways, or like she's really sensitive, so like that might be where the fainting comes from, because she's like really emotional.
Very emotional. Okay.
That's it.
And you mentioned that this seems to be sort of normalized in the family that she faints. Is there an incident that you can share, like an example of when she's had these?
Yeah, I think we were all at Thanksgiving, and at Thanksgiving, you know, before we sit down to like have dinner, and we all go around and like just play some games outdoors when we have like some good weather. And we were kind of playing like not football per se, but our family's take on what football might be. And her team was losing, and she was just like kind of being a little bit of a sore loser.
Okay.
And it was just like, I don't know. And then all of a sudden she was like, it's not fair. Your team has so many more better players. And then was like getting really upset about it. And then all of a sudden just fainted.
I see. Okay.
Yeah.
Thank you for sharing that. I appreciate the context. And any other diagnoses for your aunt?
That's it. She also says her doctor told her that she's not allowed to exercise a lot.
She's not allowed to?
Yeah.
Okay.
She has to like do low exercise. So she likes to take her walks daily. But that's kind of really
That's pretty much okay. And do you have any cousins?
I do.
On your
She
dad's?
has a son and a daughter.
A son and a daughter. And they share the same father?
Yeah.
And how old are they?
They are 19 and 26.
Is the son 19 or 20?
Yeah, the son is 19 and the daughter is 26.
Okay. And what do you know about their medical health?
They seem fine. We like grew up pretty close with each other. Like our families live close by. They seem to be doing well. Yeah, one's getting like just about to start his first year of college, and then
Exciting.
Yeah, which is exciting. And they seem to be fine.
Okay.
Yeah.
Good. No heart-related concerns or seizures, epilepsy? For
Yeah,
any of them?
not that they really know. I mean, my cousin who's 26, like she and I were kind of like sisters growing up, because I have two brothers and she has a brother. So I don't know. I said something about my heart, and she's like, "Oh, I might have something with my heart too, but I don't really know what it like." This is when we were really little. But again, like my family, specifically that side of the family, don't really talk about things. So I thought maybe there's something there, but I don't know. Maybe just we feel so connected as cousins. Yeah.
Yeah. Okay. I'm just gonna, note that down, but I'm not really gonna count that in, because it sounds like she hasn't been formally evaluated, or at least as far as you know, there's no formal evaluation done for her. Okay. And any children for the cousins?
No,
okay. And that's by choice?
By choice.
Moving on to your grandparents on your father's side. Are they living?
No, they're both deceased.
How old were they when they passed away?
My grandfather passed away at 45. He also had a heart attack, but he was really in shape the whole time. He actually used to do a lot of like running and exercise and stuff. So I'm not really sure what that, yeah. And then my grandmother passed away of old age at the age of 90.
Okay. From what you know, your grandmother did not have any major health issues. Your grandfather, from what you've heard your father mention, did he have any health issues before the heart attack, or was it sudden?
So he passed. My dad was relatively young when his father passed away, so he also doesn't really kind of talk about that as well. He wasn't like a baby, but it was just kind of still relatively young for him.
Got it. Okay.
So it's hard. He just said heart problem.
Heart problem. That's pretty much what we know.
Pretty much what
Okay.
Yeah.
And your father, before that episode at 53, has not had any health concerns?
Nope.
Okay. And what would you say is the ethnicity or ancestry on your dad's side?
Yeah. So they're originally from Yemen.
So I'm going to ask a few roundup questions that we ask all the families. Answer to the best of your knowledge, and I'm focusing on the immediate family. Okay. Anyone on either side of the family who is born blind or deaf or have any sort of hearing loss or vision problem?
No.
Okay. And anyone on either side of the family with history or diagnosis of seizures or epilepsy? The reason I'm asking that is sometimes cardiac presentations can be confused as a seizure. Have you heard anyone mention? And anyone on either side of the family with a child that died at birth or at a very young age?
No, just my brother. I mean,
Yeah.
25 is young, but
Yeah,
not
it
like
is.
yeah.
And in the case of your brother and your grandfather on your father's side, it sounds like it was sudden, right?
Yeah.
Has there been any other similar deaths in the family where they were healthy and they all of a sudden passed away, or they passed away in their sleep or while they were doing something?
My dad might have had a cousin like that. I don't know the details exactly, because already that's like more extended family. But it was a cousin through like my grandfather's brother's son.
So it was on your grandfather's side.
Yeah.
Okay. So it was your grandfather's brother's son, you said.
Yeah.
Okay. And and your dad mentioned that he passed away all of a sudden. Did he mention about any age range?
I'm trying to think. I think it might have even been in his 20s. This happened back in Yemen, so they don't really talk about it. And
Okay.
yeah.
Do you know anything about your great uncle, the brother of your grandfather?
No.
That's okay. You mentioned there were no major health concerns like heart-related or cancer in other family members, right? And your grandparents on mom and dad side of the family, they are from different parts of the world, but I'm still going to ask you this question. Is there any chance your parents are related, like cousins?
No.
No.
Actually, just reminded me of like two things. So you asked, so even though my family, yes, they're from different sides of the world, like both, my father is also of Jewish ancestry. So I know those are different like, in Jewish tradition, everyone comes together originally from one tribe or one big family, but for 2,000 years, there's kind of been this diaspora. So just in terms of, yes, they are both Jewish, but not necessarily from different parts of the world.
Got it. Okay.
So
Thank you for that.
Yeah, of course. And actually, yeah, my mom has a cousin. So let me get this right. Okay. So it's her grandmother's brother's daughter. So my mom's grandmother's.
And this is the grandmother on her mother's side or her father's side?
It's my grandmother. So it's my mother's brother's daughter. So it's my mother's yeah. And he had a daughter, and she died in a car accident when she was like 16.
I'm so sorry. Would you mind if I ask more questions about the...
Sure. I don't know so much about it, but I can try.
The reason I'm probing more about this cousin's death, you mentioned that it was a car accident. At times, individuals who have a cardiac presentation or an underlying cardiac condition can have an episode and end up in a car accident. So this accident, from what you've heard, was that... Do you know more details about it?
Yeah, so I know. I mean, she was 16. She was with a bunch of her friends. She wasn't driving. So
she wasn't driving.
No,
okay.
She was in the back seat. And I think it was late at night, and they didn't see this other car in front of them.
Thank you so much for that information. I wasn't too worried about mom's side based on the history you gave, but I wanted to make sure we are not missing out on any information.
Yeah.
And this great uncle, he's a full sibling to your grandmother?
Yeah.
Thank you so much for that information. And anyone on either side of the family with a diagnosis of autism, delays, intellectual disability, or any birth defects?
Just the cousin that I mentioned to you earlier with the autism.
No one else besides that?
No.
Cousin. And you mentioned no one with hearing loss,
no.
Correct? Okay.
I mean, my parents, as they're getting older.
No one who is like born with it or has like progressive hearing loss from a very young age?
No.
And anything else about the family I did not ask you think I should know?
I think that's it. I mean, again, I have a limited amount of history as to what I know about the family members, just because of like how we talk about it. So a lot of it is just kind of like either what was told to me or what I myself can see with my own two eyes or understand. But I think you've got everything.
Okay.
Yeah.
Thank you. Now I'm going to move on to talking about, it sounds like the doctor maybe gave you some understanding of the condition that he's suspicious of. So I'm going to give you more details on that, and then we will talk about genetic testing. So when you were admitted in the ER for the fainting episode you had, they put those stickers on you. So they were basically trying to see the electrical activity of your heart. So when it comes to the heart, the problems can be due to how the structure of the heart is, or it can be due to the electrical activity of the heart or the plumbing activity of the heart, which would be how the blood goes in and out. The one that they are more concerned about is how the heart is beating. And they're concerned about this condition called long QT syndrome, which you said you read about a little bit.
Yeah, that was one of the things that came up. And
Yeah.
I saw like related to exercise, and then they were talking about like shock or surprise and or like, stress. And I was thinking a little bit about that too.
From the history that I'm gathering, there are some family members who died at a very young age, and you're describing fainting episodes. It's making me a bit suspicious. And what happens in long QT is the way the heart beats, it usually takes a break in between the next beating. In the case of long QT, the break is longer than what you would expect. And you mentioned about this T wave or this QT that they saw. So that was probably what they explained to you, that it was taking a bit longer than usual to go back to its activity. The condition, as you read online, can be triggered by different reasons. From what I'm hearing you say, it sounds more like stress or emotion related that you've described in your family. There are thousands of tests in the market, and this is helpful for me to help determine what would be the best we can offer you. And like I said, these are options. You don't have to do it. The way that genetic testing works is, because there are thousands of tests in the market, we try to pick the one that would make the most sense for you. Okay. And we can go narrow or we can go broad. And the way genetic testing works is all of us, you, me, everyone in this world, we have the same set of genes. It's the instruction on the genes that vary from individual to individual. And what I mean by the instructions on the gene is, when you take a gene and you look at the information on it, there are 4 main building blocks, A, T, G, and C, which are arranged in different combination like this. All of us have changes, meaning, say for instance, in this position, instead of it being a T, it's changed to a C or an A. Majority of the time, these changes are not concerning. They just make us who we are. In very small instances, it can prevent the gene from doing its job. And what your doctor wanted or recommended for you to do is to see, is there such a change that might explain why you are having these fainting episodes and what happened with your brother and your dad's side of the family. Okay. And it can be a blood draw, or what we call as a swab, or we collect your saliva to send the testing. And the results usually take about a month or month and a half to come back. And anytime we do genetic testing, so I mentioned about these changes, right? These changes can fall in one of 3 buckets. Okay. The first is where the lab can say, hey, we saw some changes, but these changes have been reported in other healthy individuals. We have substantial evidence to say this is not concerning. And they would call that as a negative or a normal report. And the second scenario is where the lab can say, we saw a change that we have seen in other affected individuals. There is strong evidence to say that this is associated with disease, is the root cause of why your patient is having the symptoms, which they would either put in the bucket of a pathogenic or a likely pathogenic finding, and we would call that as a positive report. In between these two is a gray bucket where the lab might see some changes, but they're limited in the information they have to put it in the bucket of positive or the bucket of negative. And they call that as uncertain findings. And uncertain findings, majority of the time, almost 90% of the time, they end up being normal. So unless there is strong evidence, we are not going to act on it. Any questions so far?
Yeah. So you're talking about like change to my DNA. And then you mentioned like we're seeing these things, like especially after like the way you've drew it out, like it seems like it's like my dad's side of the family. Is it like, I mean, I get so much from my dad. I look just like him. We have like a similar sense of humor, and everyone's like, oh my gosh, that is your dad. But like, did he give this to me? Like, did he give this to my brother? Like, is it his fault? Like, I mean, like, I know it's not his fault because he must have gotten it from somewhere else. Like,
it's not his fault. When it comes to, again, before we get to that part, we are suspecting that it could be from your dad's side of the family based on the history that you've provided me. It could very well be something that is just new in your brother or new in you. We wouldn't know until we do the testing. And even if the test comes back saying we go down the testing route and we see that your dad has the change, your dad did not have any control over this. None of us have control over the genes or the changes that happen in the gene.
okay.
Okay. It sounds like there's more that might be happening. what's going on in your mind?
Yeah. It's very interesting. So I'm someone like who grew up the age of the internet, so I have access to a lot of these things. It feels like the rest of my family doesn't talk about their medical history. It's kind of like taboo. And in terms of like a lot of things medical, they'll like attribute it to family stuff or like higher power or other things where that they'll kind of be like, it's religion or it's sin or, and it's just like, you and I are just like sitting here now. And this is just like understanding, like, I was just trying to understand myself, but now this is like, and I'm still kind of like grieving my brother and like trying to make sense of all of this. And then like, A, for myself, and then B, to kind of like discuss it with my family seems a lot right now. And like, I wouldn't even know how to talk to them about this.
You sound overwhelmed and also frustrated. It sounds like the lack of conversation and transparency in the information about medical history is frustrating you, and you are anticipating them denying your concerns by bringing in religion.
Yeah. A little bit more religion, but I think more like they're kind of like emotion oriented. Like they feel like if you think positive, things will be positive. If you think negative, things will be negative. So knowing that like I'm a pretty positive person, but then like, so there must be something that I'm thinking about negatively, or I don't have a good perspective on the world, or I think what's like happening now is like, yeah, like just trying to reconcile with all these pieces, and then whether or not like I mentioned, if this impacts my cousin, I think it's harder for like my dad and his sister and like those cousins to kind of really contact. But if I can talk to like my cousins on my dad's side, they're like more in the know, and I feel like I can definitely talk to them. So if this testing will kind of like illuminate what's happening in my family, I'm happy to kind of like, I'm definitely going to think more about it.
And I'm so sorry to interrupt. I feel you're getting overwhelmed with the entire conversation that we had. We don't have to think about all of it right now.
Okay.
We can take it one step at a time. Okay. We can start with testing you because you're showing signs and symptoms of this. And it will be extremely helpful to know what your brother's autopsy report showed. And if the autopsy was done in New York City, the medical examiner's office in New York, they do perform genetic testing. So they may have performed testing. Okay. And I'm not going to just send the testing on you, give you the results, and say bye. I'm happy to be involved and provide support as long as you need in even the conversations with your family. It does not all have to be on you. Okay. And irrespective of what the findings are, I will give you a detailed summary so that you can have those conversations with your family. Or if you feel, no, I want you to talk to them, it's going to be hard for me to get through to them, I'm happy to do that. Okay. But let's take one step at a time.
Yeah, that sounds good.
Does that sound reasonable to you? Okay. And I'm sorry that you're having this dynamic. All of us have these different family dynamics, and I can relate to what you're saying. It is a challenging conversation to have, but I hope once we get to that part, we can come up with how we want to approach this with your family.
Yeah, that makes sense. It's funny because I'm like in school for social work. So it just like, I understand that families are complicated and things are dynamic, but it's just funny when you're kind of in the hot seat.
There's some things you learn and then there's family and you have to find the middle ground with them. Now going back to the conversation about the genetic testing, and I also started talking about the long QT, and we deviated into the genetic testing part. I want to add a little bit more to the long QT conversation we had. So I told you about how that happens. Why it's important is because majority of the time, not all individuals are lucky to be caught or get medical attention immediately. Instances like what happened with your brother or your cousin on your dad's side can happen, or that can be the first symptom we see. And the benefit of knowing or having a diagnosis is so that the doctors can be on top of your care, prescribe the appropriate treatments for you, and take care of you. Okay. Sometimes the EKGs can pick up on a long QT pattern that's prolonged, not necessarily because there is an underlying genetic cause or underlying diagnosis of the condition. It could also be due to any sort of imbalances, and that's why I want to know about your dehydration or any electrolyte imbalances or neurological concerns where there's like a bleeding that's altering the mental status of the person. So it's helpful for me to know more about what your history was at the time of your ER admission. If you are able to get me, I just want to know, did they do like an electrolyte panel on you when they did the EKG? It's just helpful. But if you're not able to get your hands on that, that's completely fine.
Yeah, no, I think I should. It's still, I think we're all part of like in network with like the hospitals and stuff. And I use that like my chart thing. And I think I can like, might be able to connect it.
Yeah, I think you just need to give your consent for it. And then we'll be able to request the records from them. And I can ask the secretary to give you the consent forms.
Okay, excellent.
Okay. And going back to the testing part, we spoke about the different types of results you can expect. I told you about the timeline of when to expect these results to come back. Do you have any further questions about the test?
No.
No. Okay. So with respect to the genetic testing, there's this act that was passed in 2008 called GINA, Genetic Information Non-Discrimination Act. You might have come across it when you read online. So what this act does is it protects an individual who's undergoing genetic testing or has genetic testing done from being discriminated with respect to their employers or their health insurance company. In other words, health insurance companies and your employers cannot request this information or deny services or deny any sort of resources based off of the genetic test results. However, it does not extend to life insurance, long-term, and disability care.
Okay, yeah, my parents already took care of life insurance policies after my brother died. Yeah,
Okay.
so we each have one. Yeah.
So you're not too worried about the testing
No.
coming back positive?
Yeah.
Great. Okay. Now I want to bring back the conversation we had in the beginning of the session. Like I told you, you've heard about the pros and you've heard about one of the cons. The other aspect is, from the discussion we've had, I'm sensing that you are finding it a bit challenging to have these conversations with your family.
Mm-hmm.
And so I want to ask you more about how would you feel if the testing came back with a positive finding?
Yeah. It would explain a lot of things.
Okay.
So that would be clarifying. I mean, it would be kind of, I think like sometimes having the positive will kind of give you like a diagnosis and it kind of like just allows you to really make sense of what's happening. So I feel like that would be really helpful for me. I definitely, before doing the testing, I would want to talk to my family about it first. I think I
Okay.
would first talk to my older brother about it.
Okay.
Just to see, like, get him on my side. And that way the two of us can like approach my parents.
Okay.
And kind of like make the conversation like de-escalate a little bit more and have that more approachable and then kind of talk about it long term. So I definitely, even before doing testing, I would want to talk to him because we're very close, and then we can kind of talk to my parents about it. And then the terms of the testing for me, if I come back positive, does that mean like what does that mean for me? Like, does that mean I'm gonna die or yeah?
Great question. No. To answer the last question that you asked, no. What it would mean if you come back with a positive finding, what that would tell me and the team, the care team, is that you're at an increased risk for this condition and you're already having some signs, but it would give more explanation for why you're having it. And your cardiologist is going to talk to you about the management and treatment plan.
Okay.
That's not something I would recommend. It would be him. I can share what literature is available. And I also have some resources for you to take home to read more about the condition. I know you read online about it, but I would like you to have more trusted sources of information.
Yeah, I appreciate that.
And it would just mean you would be the same Lev that you are, the amazing person that you are. It doesn't change anything about you, or how you go about with your life might be tweaked a bit based on the finding, because like I said, there are different types of long QT and different types of arrhythmias, and the genetic finding, if we have one, will give us, you can think of it as giving your doctors a pair of glasses to see you better on how to provide you better care. And what are the resources we should be offering you. Sometimes a cardiologist might put you on some beta blockers, or they might talk about an ICD or a defibrillator, depending on what the finding is. Okay. And if it comes back normal, meaning the test does not find an underlying genetic cause, it does not take away the possibility of long QT because we still haven't done the stress test. We still haven't done I think he was talking about the Zeo patch for you. So those are still pending. So if clinically that is evidence to say that you have long QT, then you do have long QT. It's just that we have not identified an underlying genetic cause.
Okay, that makes sense.
Okay.
Yeah.
And from the discussion we had earlier about your family, it sounds like you're anticipating some sort of judgment or pushback from your family if you go ahead with genetic testing.
Maybe a little bit, but I like the way you framed it as like glasses. We're big glasses wearers at home. And sometimes just using like some kind of like metaphor is like really helpful for them.
Okay.
So I think framing it that way might actually be helpful in terms of just like understanding more, like instead of, it's not like this is something I'm already dealing with. Like it's not something that I caused or anyone caused. It's not like being too emotional. And I think if we would also kind of like have a genetic basis for it, it would actually be easier to kind of approach these like larger conversations about medicine with them too.
Absolutely. And like I said, you don't have to tell them about testing the rest of the family. You can just
talk about it.
Talk to them about why you need testing.
Yeah.
And I understand families being involved in these major decisions, and I will respect your decision to hold off on testing right now.
Yeah.
What we can do is when you step out, you can just make a follow-up appointment with me, say like in a few months. Does that sound reasonable?
Yeah.
Okay. And I'm going to give you information about the condition, but I'm also going to add, now that you are planning to talk to your family and especially your brother about the testing, I'm going to give you some resources related to what to expect in a genetic testing. And take it home. I know there's a lot we discussed today. There's a lot to process. When you go home, questions come up, you read these materials and you have questions, or you read things on Dr. Google and you have more questions, you have my contact information.
Okay, excellent.
Okay.
Yeah.
You don't have to go through this by yourself. You don't have to deal with all of this information by yourself. I'm here to support you and help you. So feel free to either give me a call if you don't reach me, leave me a voicemail, or email usually works best. Any other questions, Lev, before?
No, that's really, it's been really helpful talking to you today. Like I had all these different questions and concerns kind of like jumbling in my mind, and I felt that you were able to kind of bring it all together and answer my questions and kind of talk this all through. So thank you.
Thanks for watching DNA Today. To access all of our episodes, head over to dnatoday.com. We also have a lot of bonus content on there that you can enjoy. If you have any questions, comments, suggestions, guest pitches, you name it, send them in to info@dnatoday.com. We'd also really appreciate if you could take a moment to rate and review the podcast on Apple, Spotify, wherever you listen to the show. It really helps more nerds like yourself find the show. Also, if you like giveaways and other ways to connect with us, I recommend following us on social. We're at DNA Today Podcast. We also have a Patreon if you want to be the most level involved in the show. That's also at DNA Today Podcast. Thank you so much for listening and watching. Join us next time to learn and discover new advances in the world of genetics.